If you think you're having a heart attack and you don't do this in the first 3 minutes, you could die. Because during a heart attack, minutes matter. But if the heart attack turns into cardiac arrest, seconds matter. As a cardiologist, I can tell you your job is not to be tough. Your job is to stay alive until help arrives. So in this video, I'll show you exactly what to do, and as importantly, what not to do during the first 3 minutes of a suspected heart attack. And to make this real, let me tell you about one of my patients, Robert. Robert is a 56-year-old, was sitting at his breakfast table, and then Robert made the mistake that almost guaranteed he will never return home. So let's walk through what Robert should have done step by step before help arrives. So Robert did what so many people do under these circumstances. He grabbed his car keys. And what happened next is the reason why I'm making this video. So stay with me because I'm going to walk you step by step for the first 3 minutes of a suspected heart attack. The first minute is where most people lose precious time. They tell themselves, oh, well, it will go away. Maybe it's just indigestion. And maybe I can wait and see. Maybe I just need to rest a few minutes. That's a trap, because if this is a heart attack, the clock has already started. In the first minute, your job is simple. Stop what you're doing, sit down, and call 911. Not your spouse, not your children, not your neighbor. Call 911. Your family could be called number 2. Put the phone on speaker and say clearly, I might be having a heart attack, and then give your address. And if you are alone, and lock the front door. This can make a big difference between paramedics helping you or saving your life or wasting precious time trying to get into your house. Now listen carefully. Do not walk around the house. Do not go upstairs. Do not change clothes. Do not look for your insurance card. The ambulance is not just a ride. It's the first step of treatment. They can give you emergency treatment if your condition deteriorates, and they can alert the hospital before you arrive. During a heart attack, getting help fast can save your heart muscle. And if that heart attack turns into a cardiac arrest, getting help fast can save your life. So minute 1 is simple. Stop, sit down, and call 911. Now comes minute 2. This is where panic makes people do dangerous things. They stand up, they pace, they try to walk it off. If this is a heart attack, part of your heart muscle is not getting enough oxygen, enough nutrients. So do not make your heart work harder. Sit down, stay still, and breathe slowly. And if you can even sit on the floor with your back against the wall or a couch or a chair. Why? Because if you suddenly pass out and you are already low to the ground, you are less likely to fall and hit your head and turn one emergency into 2. The simple rule is this: stop moving, sit down, and save energy. Now, should you lie down? There's some confusion about this. What you should do in general is sit down and lean your back against the wall or a couch. Should you lie flat? Most people who are having a heart attack should sit down and lean back on the chair or the couch. Because if you are shortness of breath, lying flat can make your breathing harder because it puts more strain in the heart. Only if you feel lightheaded, like you're going to faint, then you should lay down flat, but do not elevate your feet up and put your head down. Now, while help is on the way, there are 2 questions regarding medication. Should I take aspirin? Should I take nitroglycerin? First, aspirin. If you're not allergic to aspirin, your doctor has not been told that aspirin is dangerous for you, put an aspirin under your tongue and chew it. Do not swallow it whole. But listen carefully. Do not delay calling 911 to look for aspirin. Call first, aspirin second. And if you are unsure, wait for the dispatcher to give you instructions. What about nitroglycerin? If you have been prescribed nitroglycerin by your doctor, put one under your tongue, usually 0.4 milligrams. Again, do not swallow and let it melt. But do not take nitroglycerin if you recently has taken medications for erectile dysfunction, like Cialis, Levitra, or Viagra, or similar drugs. That combination can lower your blood pressure to dangerously levels. So minute 2 is simple. Sit down, stay still, do not put your feet up in the air. Chew aspirin if you're not allergic, and use nitroglycerin if it has been described for you. But again, remember, the aspirin is not a reason to wait, nitroglycerin is not a reason to wait, nothing is a reason to wait. Calling 911 is first. Now comes minute 3. This is where the people around you can save you precious time. One person should stay with you. If there is another person with you, they should open the front door, and they should get an AED if there is one nearby. If you are in a gym, if you are in a church, an airport, an office, senior centers, community buildings, there are AEDs available. Someone should get it as soon as they can. That's because if a heart attack turns into cardiac arrest, this small machine, one similar to this, will save your life. And remember the difference. A heart attack is a plumbing issue. One of the pipes going to the heart gets blocked. But a cardiac arrest is very different. The electrical system in the heart short circuits and your heart stops completely. There is no blood going to your brain. So during a heart attack, minutes matter. But during a cardiac arrest, seconds matter. Now let's talk about breathing. What should you do? Breathing does not stop a heart attack. Breathing does not open the arteries. But panic will make everything worse. Panic will make you breathe faster. It will make your heart rate go faster and make it harder to think clearly. So while help is coming, try this. Breathe slowly. Breathe in gently through your nose for 4 seconds, and then breathe out slowly for 6 seconds. Do not strain, do not hold your breath. Just slow, calm breathing. This is not a cure. This is control, and control matters. But what if the person suddenly collapses? This is the moment everyone fears, but you need to know exactly what to do. If you witness somebody becoming unresponsive, not breathing or gasping for air, call 911 if it has not already been done. Put the phone on speaker and then start chest compressions and press hard and fast in the middle of the chest. And if there is somebody around, or otherwise, if there is an AED around, you need to get an AED, a machine like this, and follow the voice instructions. And the machine will guide you what to do. Now, let's make the whole plan easy to remember. And take a screenshot of this. It may be the most important photo on your phone. We use the word calm. C for call 911 first. A for aspirin. L for lean back and rest. And M for monitor. And watch closely. This is the calm method. Now, let's talk about the warning signs, because this plan only works if you recognize what is going on, and that's in fact an emergency. Many people think the heart attack always comes with a crushing chest pain. And sometimes it does, but often it's more subtle. It may feel like pressure, fullness, a burning sensation, indigestion, shortness of breath, sweating, and the pain or pressure may go to your neck, to your jaw, to your shoulders, even to your back. And sometimes it's just a strange feeling that something is very wrong. And in women, in particular, people with diabetes and older adults, the symptoms can even be more subtle. That's why wait and see is dangerous. If something feels wrong, call 911. And if you want to learn the warning signs of a heart attack, watch this video, Top 7 Signs Your Heart is About to Stop. I'll put a link above and on the description. Because recognizing early symptoms could save your life. So we've talked so far what to do in the first 3 minutes of a heart attack. Let me tell you about 3 mistakes you should never make. and stick around for number one, because that's the one Robert made and almost cost his life. Mistake number 3 is very common. People think, maybe I can't walk it off. Maybe I should get dressed. Maybe I should wait and grab a few things. No. If this is a heart attack, walking around will make your heart work harder. That's the last thing you want to do at this point. This is the time to stop what you're doing, sit down, and wait for help. Here's a mistake number 2. This sounds smart, but it is not. Don't put your feet up in the air and your head down. This will make things worse and worsen your breathing. In general, you should sit down, maybe lay back, and try to relax. Only lay down on the floor if you feel you're going to faint, you feel lightheaded and dizzy. And here's the mistake Robert made. He thought, the hospital is closed, I can make it. That's what many people do. But a heart attack can suddenly turn into a cardiac arrest. And if you're driving when you have a cardiac arrest, you're going to crash, you may hurt somebody, and nobody's going to help you. Remember, an ambulance is not just transportation, it's treatment on wheels. Now let's finish Robert's story. Robert was driving himself to the emergency room. While he was driving, he called his wife. His wife happened to be a registered nurse. So she recognized immediately what's going on. She knew this was not indigestion. She called 911. And just as they were pulling into the hospital parking lot, Robert went into a cardiac arrest. His heart stopped pumping. He passed out. But this time he was not alone. He was with the paramedics. They started CPR and used a device like this, the defibrillator, to shock him back to life. Here's the part I want you to remember. If this cardiac arrest had happened just a few minutes before while he was driving, the story may have ended very differently. That's why this matters. In an emergency, the person next to you is the one who has to act. So don't just like this video, send it to the person you live with, because one day this plant could literally save your life. And if you want to learn more about the food that prevents heart attacks or even strokes, watch this video. This one food prevents heart attacks. And remember, your health, you must preach, as I said, take control. See you next video.